Please welcome Julie to the show along with radiologist Dr. Penny Roumanis. Thank you for sharing your journey with us. I know you don't have your results yet.
No.
You pretty anxious?
Yes.
So,
yeah.
So let's just cut to the chase here. Dr. Roumanis, what did you find?
After reviewing everything, I'm happy to say you're cancer-free.
Yay. Saying a lot.
Thank you.
That's saying a lot because MRI is really our best tool at looking at breast tissue. So if you have a breast cancer right now, MRI will find it reliably 90% of the time. Mammography way down, like 40%. Wow. It can get higher with adding ultrasound, et cetera. But so you can really exhale. You do not have breast cancer.
Yes. Had lots of prayers being said for me.
Let's talk, both of you are experts in this, talk a little bit about, for women out there, now a new option, there's so much confusion about screening and where this plays a role for most women out there.
A lot of women have dense breasts, and dense breasts makes it really difficult for radiologists to catch lesions. So it causes a lot of anxiety because patients have to come and follow up. And then people are they think, oh, I got to go back. I definitely have cancer. And they don't. It's just we got to make sure nothing's there. So with breast MRI right away, you can see if the lesion's bad or good or
so
nothing.
There's two positives. It's more sensitive.
Mm-hmm. Correct.
And it's more specific, meaning you know if you see something that's a little bit scary, you have a better sense for what it is.
There's still a false positive rate between 10 and 20% of the time when you'll see something, maybe it's nothing, come back in 6 months. So it's not a complete foolproof exam.
Correct.
The big problem right now is MRI is largely uncovered. Mm-hmm. It can run up to $3,000. We need to get this fast MRI would be awesome because it takes a 45-minute MRI down to 10 minutes.
And the way to do that is just cut down the sequences. And so she was in there for 3 to 10 minutes rather than 20 to 30 minutes.
And I'm curious your perception of this as compared to mammograms.
Well, the one nice thing is that, and I knew they knew the results and they wanted to share them today, so, but to know that you would know your results the day of is amazing to me.
I think that you were concerned about the pain too.
Yeah, I mean, no pain.
Yeah, this is one case where women come in all the time and they avoid the mammograms because they really, are really scared of the pain with the mammogram.
Right, there's no squishing and there's no radiation, so women are like, sign me up. But I want to pull this back a bit. Mammography is still the gold standard in breast cancer screening. It's cheap, it's fast, it's covered, it's easy. It's just not as accurate as MRI, but when you're talking about screening the masses, you have to use a technique that's widely available, covered by insurance, and radiologists have expertise in reading. And
so Julie sounds like was the perfect candidate for something like this. Is there going to be a time where this is more readily available, where it's cheaper?
Maybe not for every woman, but I'll tell you the top people who should consider breast MRI, even now, even the 45-minute one. So gene mutation carriers like BRCA have a very high risk of breast cancer. A person who has had breast cancer herself, particularly if she were premenopausal like your sister was, or has dense breasts, or her first cancer was missed by a mammogram. If you had chest wall radiation because of Hodgkin's disease between the ages of 10 and 30. And finally, anyone with a lifetime risk that exceeds 20%, which, Julie, you exceed. Having a first-degree relative doubles your risk of breast cancer. 1 in 8 now becomes 1 in 4. So you should be regularly screened.
We are so obviously sad that you lost your sister, but we're also very glad that you had a negative test. Thank you for sharing.
Thank you.